Hi there everyone, my name's John Skinner. I'm going to talk to you today about having a contingency plan in place in case your Congress has to go virtual. There's a lot of information out there about events in general, but there seems to be nothing specific about medical societies and medical congresses. So I hope it's relevant to you. So at the moment there's an awful lot of medical congresses that have been postponed until August, September, October. But the way the situation is developing, it looks very much like we're not going to be able to hold get-togethers until much later, until somewhere next year. Therefore, your Congress is likely to be cancelled. It would be great to have a plan in place so that if and when that happens, that you're ready for it. So as a starting point, we just think about the basics of our Congress. Why do people come to our Congress? Why do sponsors come to our Congress? What do they get out of it? With medical congresses, content is generally king. Delegates measure their success on what learning they've got out of it when they leave the Congress. And secondary factors can be networking, very important, to meet up with peers that you only see once or twice a year. And just to be seen at the Congress is very important for a lot of people. What about the structure of your virtual event? Your face-to-face event is likely to be a 3 or 4 or 5 day affair in an exotic city, where everyone blocks the time off work and travels and is available pretty much all of the day. At a virtual event, it's very different. We are now competing with home distractions such as Netflix, such as taking care of children. It's a good idea to schedule something like about 5 till 7, 5 till 8 every evening so that everyone knows 5 o'clock I have to go to the Congress. And then to continue that for 10 to 14 days. I feel that's a good number because it keeps a momentum going. It's not too long that it sort of tends to sprawl. Some congresses have gone on virtual congresses have gone on for 30 days, and the comments that have come back is that it's just a bit too long. And it's important for delegates to be able to access content outside hours. On pricing, a lot of congresses have gone for something like 50 to 60, 70% of the face-to-face registration fee, which I think is reasonable. I think we've got to accept that virtual cannot command the same price as a face-to-face event. But here we've got an opportunity. We've got an opportunity to reach out to delegates who wouldn't normally have been able to attend our Congress from far-flung areas, from Africa, from China, from wherever. I'm talking from a European perspective. So this is an opportunity. We can develop offers for certain groups. We can make it free. A certain amount of content is free, for example. There's a lot of creative opportunities here. What about the threats and risks of a virtual Congress? First and foremost is that the speakers or the delegates will not be able to access the platform. They'll have internet connection problems at the last minute, or they'll have difficulty using the platform. So it's very important, firstly, that you train the delegates in how to use the platform and the speakers. And my recommendation would be that you pre-record as many sessions as possible. So 2 weeks before the Congress, you're getting speakers to send their recordings into you. Now, with a virtual event, you want to try and maintain as much of the interactivity, the sense of community, the sense of fun and excitement that you get at a face-to-face event. The good news is that there's tech and there's simple tricks that can be done, simple tricks that can be implemented to help give that sensation. One recommendation would be that during the sessions you keep the chat going and encourage people to chat during the sessions. There you can see, when you're watching the session, you can see, oh, so-and-so from whatever hospital is there as well, and you can send them a message while you're still watching the session. It tries to recreate the feeling of looking around the room and you can see people, see other colleagues. What's also worked has been live discussion, splinter groups. What I mean is that coming from a session, there's been during the chat or during the questions, there's been a topic that's come up. So you can say, why don't we get together? Why don't we get together? People are interested in this topic. We get together and we have a 1 hour discussion round table about this topic. What also works very well is audience polling. So during a 45-minute presentation, for example, the speaker would launch 3 questions to the audience. Patient of 80 years old, hypertension, how would you treat that patient? And then the audience would answer multiple choice and the speaker would explain the correct answer. Other ideas that have worked really well are, for example, uploading selfies of you and your team at the hospital with your coronavirus mask on, or videos of your hospital's experience of coronavirus. What funny stories have you got? Even things like videos of your children singing, this sort of thing. People love that. That's what people, at a live event, people get together in the coffee breaks and during lunch, and they chat about what's going on in the hospital, what their children are doing. If we're trying to recreate that as much as possible in a virtual setting. But what we want to get away from is it just being a series of webinars. We can do a lot better than that, quite simply. So that's all for today. In my next videos, I'm going to talk about tech, what tech platforms are available and how to get the best mix for your Congress. Also about sponsorship, how to keep sponsors on board and how to give them value. And then how to promote your Congress in an optimum way to keep as many delegates as possible and how to gain new delegates.